So for the next question, let's go to one of our off-site interviews, and we are very fortunate to have with us Dr. Greg Rybakov from Maimonides Medical Center. Dr. Greg Rybakov is the Director of the Cardiothoracic Surgery at Maimonides Medical Center and Associate Professor of Cardiothoracic Surgery with permanent tenure at New York University here in New York. Dr. Rybakov, you as a heart surgeon see a lot of patients with advanced heart disease. And the medical literature says that there is a link between erectile dysfunction and heart disease. How do you explain that link? How do you view that link?
Well, as you know, coronary artery disease is hardening of the arteries. It's atherosclerosis. It's building up of plaque in the vessels. And that is a process that when it occurs across the whole body. So let's just talk about this. So it's basically disease of the blood vessels. So in the coronary arteries, it happens that you build up plaque in the vessels that bring blood supply to the heart muscle. And if these things obstruct completely, it can cause a heart attack. We do coronary artery bypasses to try to avoid heart attacks and try to make people live longer, and we bring extra blood supply to these coronary arteries. But at the same time that obstructions are occurring in the coronary arteries, they're occurring in the other vessels. So let's talk about a lot of these things. So it tends to go along with obstructions of the carotid arteries, the arteries in the neck that bring blood supply to the brain. It also tends to happen in the blood vessels of the legs. And people who have coronary artery disease often have a disease or a problem called claudication, which is pain in the legs when they walk. Well, erectile dysfunction is just another example of this. In this case, the penis isn't getting enough blood supply, and it cannot function normally without enough blood supply. In many ways, it's no different than a heart not functioning properly. If you don't have enough blood supply to your heart, it won't pump normally. It will actually look weaker than it appears to be. And it seems that virtually any organ that doesn't get enough blood supply will behave in a similar manner.
Thank you, Dr. Rybakov. My next question to you, do your male patients talk to you about erectile dysfunction? Because we heard from Dr. Musa, our cardiologist, that maybe half to 3/4 of men with heart disease have erectile dysfunction. So do your patients ask you questions about erectile dysfunction? How does that come up in your practice?
It's interesting. I mean, you do hear patients complaining about it, but for the most part, the overwhelming majority of patients don't want to really talk about this. And when you ask them symptoms and what's going on in their lives, if you ask them about those things, a lot of times they'll tell you everything is fine. Or they'll tell you that they have no problems. If you do what we call a review of systems, when you take a history and do a physical exam on a patient, we ask about every organ and its function, and many times we won't get the answer. As a matter of fact, oftentimes patients won't even talk to me about it until after they're through with their heart surgery. But in my practice and at Maimonides Medical Center, we try to encourage people to talk about all the different problems that they're having, because obviously these problems are interrelated. And if I fix somebody's heart, but their life still isn't fulfilled in many other ways, then they don't really have the chance to get the joy out of their life that they need to. And my own philosophy in doing heart surgery has always been that the idea is to extend good life. And so we try to bring these things up, and then patients do sometimes ask afterwards, and when they do, we give them recommendations.
Thank you, Dr. Rybakov. And my other question to you, which comes from also many of our patients, what do you say to your patients after heart surgery about sex? When can they have sex? Can they have sex? what do you say to the men? What do you say to the women after your heart surgery?
Ridwan, this is a great question. Patients of both genders often ask in the office after they've recovered from heart surgery when they can begin having sexual relations again and exactly what they can and can't do. And this question comes from both male and female patients. It also comes sometimes from the patient and sometimes from the spouse. So, my answer varies depending on who's asking it. To be perfectly honest with you, the question comes more often from males than it does from females. But when a man asks me early on after heart surgery, after coronary artery bypass, whether they can have sex again or when they can have sex and what they should do, I usually tell them, well, to be perfectly honest with you, if you feel ready to have sex, you can have sex. But if you've just had heart surgery, I generally prefer that your spouse does most of the work. That's generally my answer. That would be true of both a male and a female, although again, the question comes more commonly from the males.
Thank you, Dr. Rybakov. And I would like to ask you now the general question in your capacity as a heart surgeon and knowing the link between erectile dysfunction and coronary heart disease and heart disease in general. What would you say to men out there, and especially men out there with erectile dysfunction who happen to be middle-aged?
Erectile dysfunction, we've had discussions about this before. Erectile dysfunction is a marker for atherosclerotic disease of the blood vessels, for blockages, hardening of the arteries, and it's very commonly related to disease of the heart. And I think a man who has erectile dysfunction is lucky if his doctor then tells him to go see his internist or his cardiologist, because the erectile dysfunction can be dealt with, although it's absolutely critical for them to know the state of their heart and their blood vessels to their other major organs, because obviously you don't want to put somebody in a situation where they're exercising, they're getting their heart rate up, they're getting their blood pressure up, as can happen during sexual relations, without knowing that their heart is okay. It's very much the equivalent of somebody coming to me and asking me about exercising. A man in his middle ages, even a woman in their middle age as well. I mean, I don't just send a patient in and say, oh yes, it's very important for you to exercise, just go to the gym and start. I will always tell somebody, go see their internist, go see their cardiologist, get a heart evaluation before you do these kinds of exercises, which can be life-threatening if you don't have a good blood supply to your heart.
Thank you, Dr. Rybakov. That was Dr. Greg Rybakov, the Director of Cardiothoracic Surgery at Maimonides Medical Center, speaking to us from the hospital in Brooklyn. Thank you. Now, Dr. Carson, you mentioned pelvic surgery or radical pelvic surgery, most commonly removal of the prostate or radical prostatectomy. What is special about that in relationship to ED?
Anything that's done to the prostate, which includes radiation therapy, by the way, but radical prostatectomy is the most severe. There are some very important nerves that follow the prostate into the penis. And those nerves that are often damaged during a radical prostatectomy, even in a very, very good so-called nerve-sparing prostatectomy, those nerves can be damaged. And those nerves are what signal the penis to produce an erection. If that damage occurs, then the resulting erectile dysfunction is very severe erectile dysfunction that often does not respond to the pills, to the PD-5 inhibitor type pills.
So men who had radical prostatectomy to survive cancer, how important is erectile dysfunction for them?
Yeah, it's very important. Obviously, their first goal is to survive the cancer and to get rid of the cancer, and that's by far the most important issue with prostate cancer. But often, a year or so after the patient has had his surgery, then he wants to regain his normal life again. He wants to be continent. He wants to be sexually active. He wants to have good erections. Today, many of the patients that we're treating with radical prostatectomy are far younger than they were a decade or two ago when they were in their late 60s. Now they're often in their early 50s, sometimes late 40s, and often have younger wives and are interested in maintaining their intimacy and their ability to have sexual activity.
So prostate cancer is being diagnosed in younger men with strong sexual desire, with younger partners or wives, and erectile dysfunction for them is a very important condition to be treated. They are very successful treatments that we will hear about in the following segments of this episode of the Dr. Ridwan Show on erectile dysfunction. So we will discuss all treatments, and we will discuss also the treatments for those who fail medical therapy. Stay tuned, and we will return with the Dr. Ridwan Show.